The information presented in this presentation is not a substitute for examination, diagnosis, and medical care provided by a licensed and qualified health professional. The opinions expressed by this speaker do not represent those of Advent Health. Please consult your physician before undertaking any form of medical treatment and/or adopting any exercise program or dietary guidelines. If you think you may have a medical emergency, call your physician or 911 immediately. Thank you for joining us for this Advent Health virtual seminar. We hope you'll find the material presented helpful and informative.
Good afternoon. My name is Dr. Trushar Patel. I am currently the Associate Professor of Urology at the University of South Florida. I am the Residency Program Director and I serve as the Director of Robotic Urologic Surgery at Advent Health Tampa. This afternoon I'm going to be discussing prostate cancer and the available treatments that are there for patients today. Prostate cancer is an exceedingly common diagnosis, and most patients don't realize that there are plenty of celebrities out there that have suffered from prostate cancer and who have been actively treated, including Ben Stiller, Robert De Niro, Roger Moore, Nelson Mandela, Colin Powell, and even Joe Torre. And there's countless others who have suffered from this diagnosis. So what is the prostate? This is a common question that we get from patients that we see. It's a male sexual gland. It adds nutrients and fluids to the sperm, and this fluid is added during ejaculation to allow mobility of sperm. The urethra is a urine channel which runs through the middle of the prostate, allowing a man to urinate. In terms of what is prostate cancer, this is an abnormal growth of cells. Prostate cancer begins within the prostate gland. It can spread to local lymph nodes, and then it can potentially spread to the bony skeleton and to other areas of the body, including the liver and lungs. In terms of prostate cancer facts, in 2019, there were approximately 190,000 new cases of prostate cancer and approximately 33,000 deaths from prostate cancer. It is the most common solid organ cancer in men, and it's the second leading cause of cancer death in this country. Approximately 1 in 9 men in their lifetime will suffer from prostate cancer. If you look at this data from SEER, looking at the incidence rates of prostate cancer from the 90s to the current time period, we see that the rate of new cancers has actually gone down, and there's been a slow decline in the absolute death rate from this disease. And so what has changed over the last 20 years? In the 1970s and 1980s, patients would present with prostate cancer with the presentation of saying, my back hurts. And in the 2010s, we see that patients present with, my PSA is high. And so the question is, why? And that comes to the question of PSA screening. So when we're talking about prostate cancer detection, we're talking about what is available to patients. There is exam, including a digital rectal exam. There's the prostate-specific antigen test, which is considered the PSA test. There are available imaging modalities, including a prostate MRI. And any in these abnormalities, such as an abnormality in a rectal exam or in a PSA elevation, can ultimately require a prostate biopsy, which can be done either through ultrasound or MRI-guided modalities. So when we're talking about PSA, so prostate-specific antigen, what is too high? Initially, it was thought that a cutoff of 4.0 was able to determine who was at risk for prostate cancer and who was not. And if you have a PSA in the range around 4, your risk of prostate cancer is about 25 to 30%. However, I think it's important to note that there's no such thing as a normal, abnormal PSA. A PSA is a tool to help risk stratify your risk for prostate cancer, and you can have prostate cancer at any level of PSA. So the higher your PSA goes, the higher your risk goes. The lower it is, your risk is lower. But it's important to also note that there are other reasons for why you can have an elevated PSA, and that can include an enlarged prostate, inflammation of the prostate, ejaculation prior to your blood test can cause an elevation in your PSA, trauma, having catheters placed, a very rigorous rectal exam, and any patient who suffers from infection or urinary retention can have falsely elevated PSA results. So if you look at the current guidelines in terms of PSA screening, so who needs these blood tests? If you look at the current American Urologic Association guidelines, men who are age 55 to 69 are recommended to have a PSA test. If you are younger than 55, this would be indicated in patients who have potential risk factors, including African American race, or if you have a direct family history of lethal prostate cancer. Some men who are 70 and above, who are in excellent health, may benefit from prostate cancer screening. These are especially noted in patients who have greater than 10-year life expectancy. Just to look at some stats regarding prostate cancer and in terms of the diagnosis, the survival for prostate cancer for 5 years is excellent. Up to 98% of men who are diagnosed with prostate cancer will be alive within 5 years of their diagnosis. So when we're looking at the stages of prostate cancer and how patients present, 3/4 of patients will actually present with localized prostate cancer, which is disease that is just within the prostate. 13% of patients will have disease that is spread to lymph nodes that are within the pelvis, and 6% of patients will actually present with metastatic disease, which is disease that is spread to other organs or the bony skeleton. When we're looking at the relative survival based on your stage, and this is 5-year survival data, 100% of patients with local regional disease will be alive at 5 years. If you have distant or metastatic disease, the survival rate is about 30%. So what can patients do? This is a common question that we are asked in the clinic. We tell patients they should maintain a healthy weight. Obesity is a #1 cause of aggressive life-threatening disease. We know that. We tell patients to eat more fruits and vegetables, whole grains and fish. A tomato-rich diet may decrease your risk of prostate cancer. We tell patients to avoid red meat, processed meat, charred meat and chicken, and refined sugars, and this has been associated with higher or more aggressive cancers. And we are adamant about telling patients to stop smoking. We know that smoking at the time of diagnosis increases the risk of advanced disease and the risk of dying of it. There's a lot out there in the media and on the internet regarding supplements and vitamins. There's been multiple studies that have shown that supplements and vitamins such as selenium and vitamin C have no effect on decreasing your risk of prostate cancer. Vitamin E has been actually shown to potentially increase your risk of prostate cancer. So that is something that we tell patients to avoid. Multivitamins, there has been no study to show that this has been proven to decrease your risk of prostate cancer or decrease your risk of dying of prostate cancer. And we do tell patients that men who take more than 1 vitamin pill a day have an increased risk of being diagnosed with advanced prostate cancer and potentially dying from it. So, this is sometimes difficult for patients to understand and convey to them, but unfortunately today, there's no pill that will prevent this disease, and that includes selenium, vitamin E, vitamin C, zinc, saw palmetto, and the multivitamins that are out there. So in terms of prostate cancer treatments, what is available for patients? There are multitude of options available to patients, including active surveillance, radiation, and this includes brachytherapy, external beam radiation, proton therapy, and even CyberKnife. There are surgical therapies, which includes radical prostatectomy, which is removal of the prostate, and this can be done either through open surgery or robotic surgery. There is cryoablation that is available, which is actually freezing the prostate. And there are more current treatments, including high-intensity focused ultrasound or focal laser ablation that's available to patients. This was a study that was published a few years ago in the New England Journal of Medicine, looking at outcomes of patients who've had prostate cancer that either were treated with observation, surgery, or with radiation. And what this study shows, and this was a randomized trial, that your risk of dying of prostate cancer at 10 years was about 1%. And now these were patients who were considered low to intermediate risk. So these were not high-risk patients. If you looked at your risk of metastatic disease, so the disease spreading, if you did nothing, so if you just watched your prostate cancer, your risk of it spreading was about 6%. If you had surgery or radiation for your prostate cancer, your risk of the disease spreading was about 2 to 3%. And I think it's important to note that all these treatments, including surgery and radiation, has obvious side effects that patients need to be aware about. So what are these side effects? And so this is something that it's important to convey to all patients and all men who are undergoing potentially treatment decisions. And that includes urinary incontinence or urinary bother. So these are urinary symptoms. And then potentially erectile dysfunction. And then the question we're always asked is, which treatment is better? And there has never been a randomized trial comparing surgery versus radiation in terms of quality of life outcomes. There have been many studies who've looked at quality of life in a non-randomized fashion, and at 3 years, it looks like that the quality of life outcomes are similar between either surgery or radiation. So this is an individual choice, and so quite honestly, there's not a true one size fits all option for all patients. And this is what we tell patients to discuss with their physician. So I'm going to talk here a little bit about robotic radical prostatectomy. In this country, about 80 to 90% of the prostates that are removed are done with the robotic platform. So in terms of the history of robotic surgery, this technology was developed in the 1980s by NASA and the US military to implement remote surgery. 3 companies held these patents, and then it was consolidated in 1990 under Intuitive Surgical. And the system that they developed is called the Da Vinci Robotic Surgical System. This is a kind of a schematic or a picture of what it looks like in the operating room. You have the robot attached to the patient here with some bedside assistance. And then if you look on the left corner there, you see the surgeon in a console, and from there the surgeon is actually directing the robotic arms. This is kind of a breakdown where you can see that the surgeon is in control and operates at the console, and then you have a surgical assist at the bedside where the robot is actually performing the surgery. In terms of the advantages of robotic surgery, the vision system, it uses a double lens laparoscope, which gives the surgeon a 3D binocular view. It can magnify up to 10 to 15 times, and it gives 75% better resolution than current laparoscopic technology. In terms of what the surgeons are actually doing, so the surgeon's hands are actually placed in special devices called masters, and they actually direct the movements of the robot. The instruments actually move like a human wrist, unlike traditional laparoscopic instruments. And the instruments are placed into the body through small keyhole incisions. So what's extraordinary about the robotic surgical system is its hand dexterity. It allows 6 degrees of freedom, which is similar to your normal hand movements. It can filter your tremor, and it also can scale down your movements by 1 to 5 times. So in terms of what are the advantages to the patient, it's a minimally invasive keyhole surgery, so you're avoiding a larger incision. It has been shown to decrease the amount of blood loss during a surgery. There have been documented shorter hospital stays. There's decreased post-operative pain, and that's due to the smaller incisions. Obviously, there's less scarring because those incisions are smaller. There's a faster return to normal activity, and obviously there's better cosmesis. So when you're looking at a comparison between open surgery and robotic surgery and which is better, the open surgery, there's longer incisions, obviously. The hospital stay has been about approximately 3 to 5 days, and you're definitely going to have more blood loss. The robotic assisted surgery, you're going to have smaller incisions. Your hospital day is normally 1 day, potentially 2 days, and there's significantly less blood loss for the patient. And this is just a schematic of what a normal open incision would be below the level of the belly button versus the 5 laparoscopic keyhole ports that would be done during robotic surgery. So in terms of comparison of surgical outcomes, so this was a study that was presented at the American Urologic Association National Meeting looking at some of the oncologic outcomes between robotic surgery and open surgery. And if you look at positive margin rate, the rates of additional therapy at 6 months and 12 months and 24 months, these were all improved in robotic surgery over open surgery. This was a study that came out of Australia. This was published a couple years ago, and this was a randomized trial comparing open versus robotic prostatectomy. What it did show that the continence rate after the surgery was 90% for both open and robotic surgery. Erectile function was about equivalent at about 2 years after the procedures, and there was a trend toward improved oncologic outcomes with robotic surgery versus the open platform. So conclusions, robotic surgery has become the preferred and most dominant approach for surgical treatment in the United States and Western Europe. It improves your morbidity, and there's definitely less side effects with robotic surgery. Thank you for allowing me to speak to you about prostate cancer and the available treatments out there for patients. This is a very important topic due to how common this disease is, and I think all men should feel free to discuss this with their primary care physician and the urologist and be aware of what is available to them in terms of future treatment options.
Thank you for joining us for this Advent Health virtual seminar. Please be sure to leave a comment below if you have any questions. If you would like to schedule an appointment, please give us a call. The information presented in this presentation is not a substitute for examination, diagnosis, and medical care provided by a licensed and qualified health professional. The opinions expressed by this speaker do not represent those of Advent Health. Please consult your physician before undertaking any form of medical treatment and/or adopting any exercise program or dietary guidelines. If you think you may have a medical emergency, call your physician or 911 immediately.